Let's get right to it. Hepatitis A is a topic that's often misunderstood, but it's important to know the facts so you can protect yourself and those around you. Whether you've heard about it in the news from your doctor or just in passing, understanding what hepatitis A actually is can make a big difference in your health decisions. Hepatitis A is a viral infection that causes inflammation of the liver. The liver, as you might know, is one of the most important organs in your body, and when it's inflamed, it can't do its job as well as it should. The word hepatitis actually breaks down into two parts. Hepa means liver, and itis means inflammation. So, hepatitis literally means inflammation of the liver, and there are several different viruses that can cause it. There are several types of hepatitis viruses, A, B, C, D, and E, but today we're focusing on hepatitis A, which is caused by the hepatitis A virus, or HAV. This particular virus is different from the others in how it spreads and how it affects your body. The liver is a vital organ handling everything from filtering toxins out of your blood, storing energy, producing proteins your body needs, to helping digest the food you eat. It's like your body's own chemical processing plant, working 24/7 to keep you healthy. When the hepatitis A virus enters your body, usually through contaminated food or water, it travels to your liver. There, it starts to multiply, causing the liver to swell and become inflamed. This inflammation can make you feel sick and disrupt the liver's normal functions, sometimes leading to symptoms like fatigue, nausea, or even jaundice. Unlike hepatitis B and C, which can stick around in your body for years and become chronic, hepatitis A is what doctors call an acute infection. That means it comes on suddenly, lasts for a short period, and then goes away completely. It doesn't linger or cause long-term liver problems in healthy people. Once your immune system recognizes the virus, it goes to work fighting it off. After your body clears the infection, the virus is gone for good. Even better, you'll have lifelong immunity, so you won't get hepatitis A again. That makes hepatitis A less severe than some other types of hepatitis, but it's still nothing to ignore. In some cases, especially for older adults or people with other health issues, the infection can be more serious and may require medical attention. In short, hepatitis A is a temporary viral infection of the liver that your body can clear completely. Most people recover fully within a few weeks to a couple of months, and serious complications are rare. The key to staying safe is understanding how hepatitis A spreads, what it does to your body, and most importantly, how you can prevent it. Simple steps like good hand hygiene, safe food practices, and vaccination can make a huge difference. We'll break down all the details in the next sections, so you'll know exactly what to watch out for and how to protect yourself and your loved ones from hepatitis A. Remember, knowledge is your best defense. So let's dive in and learn more about hepatitis A together. So how does hepatitis A actually spread? It's a question many people have, especially since the virus can seem invisible in our daily lives. Understanding the ways it moves from person to person is key to protecting yourself and your loved ones. The main route is called the fecal-oral route. This means the virus leaves the body in the stool of an infected person and somehow finds its way into another person's mouth. It might sound unpleasant, but it's more common than you think, especially in places where hand washing isn't routine. The virus can contaminate food or water if someone with hepatitis A doesn't wash their hands properly after using the bathroom. When you eat or drink something that's been contaminated, the virus enters your body and can make you sick. What's really surprising is that even a microscopic amount of the virus, so tiny you can't see it, can be enough to cause an infection. You don't need to see dirt or obvious contamination for the virus to be present. Common scenarios include eating food prepared by someone who didn't wash their hands after using the bathroom. Whether that's in a restaurant, at a party, or even at home, it's not just about strangers. Sometimes it's people you know and trust. Drinking water that's been contaminated with sewage is another major risk, especially in areas where sanitation systems are poor or after natural disasters that disrupt clean water supplies. Close personal contact matters too. Living with or caring for someone who's infected increases your risk, since the virus can easily spread in households or places where people share bathrooms and kitchens. The virus can survive on surfaces for hours, sometimes even days. Think about doorknobs, changing tables, or any shared object. If you touch something contaminated and then touch your mouth, you could become infected without even realizing it. Eating raw or undercooked shellfish, especially from water that's been polluted with sewage, is another way people can get hepatitis A. Shellfish can filter and concentrate the virus, making them a hidden danger. Contamination isn't limited to your home kitchen. It can happen anywhere along the food chain, from farms and factories to grocery stores and restaurants. That's why food safety practices are so important at every step. By understanding all these different pathways, you can make smarter choices and reduce your risk. Awareness is the first step in prevention. Practicing good hygiene, like washing your hands thoroughly, cleaning surfaces, and making sure your food is cooked and stored safely, are your best defenses. Prevention really does start with simple, everyday actions. Once the hepatitis A virus enters your body, it begins to quietly multiply in your liver, often without you even realizing it. This silent phase can last for days or even weeks, making it difficult to know you've been infected. So, what should you watch for if you think you might have been exposed? Recognizing the early signs is crucial for your health and for preventing the spread to others. Many young children show no symptoms at all, which means they can unknowingly pass the virus to family members, classmates, or caregivers. This makes hepatitis A especially tricky to control in schools and households. When symptoms do appear, they usually start 2 to 4 weeks after exposure, but sometimes it can take up to 6 weeks. This delay can make it hard to connect your symptoms to the original infection. Early signs often mimic the flu. Fatigue, nausea, loss of appetite, and a mild fever are common. You might also notice muscle aches, headaches, or a general feeling of being unwell. Abdominal pain, especially in the upper right side where your liver is located, is another frequent symptom. This discomfort can range from mild to quite severe. As the illness progresses, jaundice, yellowing of the skin and eyes, can develop. This is a clear sign that your liver is struggling to process waste products. Dark urine and pale stools are classic signs of liver trouble. These changes happen because your liver isn't able to filter toxins from your blood as it should. Not everyone experiences all these symptoms. Some people have only mild illness and recover quickly, while others may feel quite sick for several weeks. The severity can vary greatly from person to person. If you notice ongoing fatigue, abdominal pain, or any signs of jaundice, it's important to contact a doctor right away. Early medical attention can make a big difference in your recovery. Early diagnosis not only helps you get the care you need, but also prevents you from unknowingly spreading the virus to others around you. Don't ignore the warning signs. Your health and the health of your community depend on it. Stay alert, practice good hygiene, and take steps to protect yourself and those you care about from hepatitis A. Anyone can get hepatitis A, but some people are at higher risk. International travelers to areas with poor sanitation, people living with or caring for someone infected, and those in daycare settings are more vulnerable. Men who have sex with men and people who use illicit drugs also face higher risk due to close contact and hygiene challenges. People with chronic liver disease are at risk for more severe illness if infected. Vaccination is especially important for these groups. Knowing your risk helps you take the right precautions. Let's look closer at the transmission cycle. An infected person sheds the virus in their stool, often before they even feel sick. The virus can contaminate food, water, or surfaces if proper hygiene isn't followed. It survives on hands and surfaces for hours, and only thorough cooking or disinfection kills it. When someone ingests contaminated food or touches a contaminated surface and then their mouth, the virus enters their system. It travels to the liver, starts multiplying, and the cycle continues. Outbreaks can happen quickly. One infected food worker can expose hundreds. Contaminated water can affect entire communities. Breaking this chain is why food safety and sanitation rules matter. Public health measures are our frontline defense. Simple habits can stop the spread. Stay vigilant to protect yourself and your community. What happens if you get hepatitis A? Most people recover fully within 2 months. There's no specific cure. Treatment is all about rest, hydration, and letting your immune system do its job. Fatigue and nausea can make daily life tough, but supportive care helps. Avoid alcohol and be cautious with medications. Your liver needs a break. Always check with your doctor before taking anything new. Most people's liver function returns to normal after recovery. Lifelong immunity is the silver lining. Some may feel tired for months, but this usually fades. Patience is key. Your body will heal. Follow your doctor's advice for a smooth recovery. Hepatitis A is temporary, and you can beat it. Take care of your liver, and it will take care of you. Will hepatitis A affect you for life? For almost everyone, the answer is no. It's an acute infection. Once your immune system clears it, it's gone for good. Hepatitis A doesn't cause chronic liver disease, cirrhosis, or liver cancer. Your liver usually heals completely with no lasting damage. Rarely, severe cases can cause acute liver failure, especially in older adults or those with chronic liver disease. That's why vaccination is crucial for high-risk groups. For most, you recover, gain lifelong immunity, and move on. The illness is temporary, not a life sentence. Focus on recovery and rest easy, knowing your body can handle it. Prevention is powerful and simple. The hepatitis. A vaccine is your best protection, especially if you're in a high-risk group. It's safe, effective, and provides long-lasting immunity. Hand washing with soap and water is essential, especially after using the bathroom and before eating or preparing food. Alcohol-based hand sanitizers help, but soap and water work best against this virus. Practice food and water safety rinse produce, cook shellfish thoroughly, and be cautious with water and ice when traveling. Remember, boil it, cook it, peel it, or forget it. If you're exposed and unvaccinated, see a doctor quickly. Post-exposure shots can prevent illness. Combine vaccination, hygiene, and food safety for strong protection. Prevention is in your hands, literally. Make these habits part of your routine. Protect yourself and those around you. Stay proactive, stay healthy. To wrap up, hepatitis A is preventable and manageable. Understanding how it spreads and how to stop it puts you in control. Vaccination and good hygiene protect not just you but your whole community. When enough people are immune, the virus can't spread. This is herd immunity. Your healthy habits have a ripple effect. Talk to your doctor about the vaccine, especially if you travel or are at higher risk. Ask questions and stay informed. Your health is worth it. Prevention is a daily choice. Wash your hands, watch what you eat and drink, and use the tools of modern medicine. Hepatitis A is a challenge we can overcome together. Share this knowledge and help keep your community safe. Healthy choices today mean a safer tomorrow. Stay safe, stay healthy.